Good day, class. You are welcome to another class, which is today's class. That is GST 223, Pharmacology. Well, we are still under Introduction to Pharmacology. Like I've said in my previous class, that for us to understand pharmacology, we need to look at the introductory aspects. Then before we are able to move further. Well, today I'm going to talk about drug. And because from the definition of pharmacology, we say it's a branch of medical science which have to do with the study of drug and its effects in the human system. So what is that drug? That is what we are going to look at today. We are going to look at a lot of topics today under drugs, starting from the definition of drug, major uses of drugs, sources of drug, routes of drug administration, principles of drug administration, and even factors that influence or affect the effects of drug. Let's start from the definition of drug. From definition, drug is said to be a chemical substance. When taken into the body, it affects body physiological process. We all know that drugs are chemical substances. Whenever you take them into your body system, it affects your body physiological process. What do we mean by body physiological process? This is how your body functions. So whenever you take this drug into your body system, it affects the functioning of your body, either to enhance the function of your body or to alter the function of your body. And that is what drug does to the body. Then we have major uses of drugs. Remember, I said these drugs are very, very important to the body, how they act on the body system to produce positive effects, and likewise, they also produce negative effects. So let's look at the uses of this drug. One, we have preventive. We are meant to understand that drugs are used for preventive measures, meaning whenever you take in, it prevents you from series of diseases or illness, such as hepatitis, such as HIV and other viral infections. Whenever you take drug, it prevents you from such diseases. An example of these drugs are vaccines. Vaccines are for prevention, so they are drug equally. Whenever you take them in, they prevent you from such diseases. Then, apart from that, we have diagnosis. Drug is also used for diagnosis. What do we mean by diagnosis? Diagnosis is just the process of identifying a particular problem. So, here we have radioactive dyes. Radioactive dyes are a form of investigative drugs. They are a form of investigative drugs. You use it for diagnostic investigations to identify a particular disease. Actually, the radioactive dyes are made up in form of drugs, but they are not used to cure disease or to treat disease. Rather, they are used to carry out investigations just to identify a particular problem in your body system. Then we have curative. Drug is used to cure diseases, as we all know. Whenever you have certain diseases like malaria, typhoid, and others, you take in drugs just to cure these diseases. That is, if the diseases are curable. Then we also have health maintenance, help you to keep body functioning normal. Whenever you are having health challenges, you take in drugs just to keep your body functioning as usual. So we have symptomatic. Drug relieve disease symptoms. Whenever you have a particular disease or symptoms related to a particular disease, such as headache, fever, and other things, you actually take drugs just to relieve these things or these symptoms. For example, whenever you're having malaria, you have manifestations, which is signs and symptoms. You go ahead by taking drugs. Sometimes you prescribe drugs for yourself just to relieve these symptoms. You may be having health challenges, but you don't actually know the diagnosis of that particular problem you are having. But what do you do sometimes? You prescribe drug. You go ahead by prescribing drug for yourself just to at least relieve these symptoms you are feeling or you are having. So, and these are major functions of major uses of drugs. Sorry. Then, apart from the major uses of drug, we have sources of drugs. These are where drugs are being gotten from. That is the genesis of drug itself. Here we have animal source, we have plant source, we have mineral source, we have synthetic source, and we also have microbial source. These are sources of drugs. Let's start from the animal source. We are all meant to understand that there are drugs that are gotten from animal. These drugs, they are extracted from animal, and such as pig, sheep. We also have fishes, like that of drug called cod liver oil. Cod liver oil is gotten from fish. We have drugs like insulin. Insulin is gotten from a horse. Then we also have some drugs like thyroxines. Thyroxines are synthetic drugs which are gotten from certain animals, such as the thyroid gland of a sheep and other things. So these drugs are exactly extracted from the animal, then later they are combined together with chemicals to form a particular drug which is supposed to be taken into the body system. Then that is how drugs are being extracted from animal. Then aside from that, we have plant source. These are drugs gotten from plants, natural drugs, and I'm sure that up to date we still have drugs that are still gotten from plants, and up to date they still discover more plants where they later combine with chemicals and form or manufacture drugs as far as research keeps going on. An example of drugs gotten from plants or plant source are the quinine. From our history of pharmacology, we say the quinine is one of the drugs that are gotten from root of plant called cinchona bark. These root of plant are the kind of plant that where you extract quinine from, and we all know what quinine is used for, used in treatment of malaria. So we also have squills. Squills is also used in treatment of intestinal worms, that is worm infestations. Then these squills are gotten from castor oil. Castor oil too, we have castor oil is gotten from a root of plant too, which is used in treatment of what is it called, constipation. Is a stool softenant. It's also gotten from a root of plant. Squeeze too. Squeeze is also gotten from a root of plant. Squeeze is used for in treatment of intestinal worms, that is worm infestations. These drugs are also gotten from root of plant. There are many drugs that are naturally gotten or extracted from plants, and these drugs are used today in treatment of several diseases. Then we have mineral source. In mineral source, there are drugs gotten from minerals such as iron. It's used in treatment of iron deficiency and anemia. Zinc, which is used as supplements. These drugs, they are gotten from minerals. We have iron, we have zinc. These drugs are gotten from natural minerals, and majorly they are used in treatment of anemias. That is a situation where you lack or you have shortage of red blood cells. Remember the components or essential materials needed for production of red blood cells, minerals are there too. So these drugs are naturally gotten from minerals, and later they are compounded into drugs, and you take them and they work as the natural minerals we have, and these are mineral source. Then we have the next source, which is the microbial source. These drugs, microbial source, they are drugs extracted from microorganisms. These drugs are naturally extracted from microorganisms. These microorganisms are majority of these microorganisms are dead microorganisms, so they extract these drugs from them and later join them or compound them with chemical, and drugs is gotten from there. Example of drugs such as penicillin. Penicillin is a good example that is gotten from microorganisms. So then we have semi-synthetic source, or you call it synthetic source. These are drugs that are made from chemicals such as estradiol, ampicillin, and also methyl testosterone. These are hormonal drugs. Majority of these hormonal drugs, they are gotten from semi-synthetic, meaning they are extracted from their form of animal source, but later converted to semi-synthetic source, meaning they are combined with a lot of chemicals to form a particular drug. And that is why majorly when you look at them, they are more of hormonal drugs. Then these are sources of drugs. Then let's go to the classifications of drugs. Drugs are made up of different classes, irrespective of where they act on. Because of time, we are not going to waste much time in classifications of drugs. We are going to mention commonest class, then we mention examples of drugs under this class. Number one, we have analgesics. We all know analgesics are drugs that are used to relieve pain, or you call them pain relievers. In analgesics, we have different types of analgesics. We have the opioid analgesic and non-opioid analgesic. Or you call it, yes, opioid or non-opioid analgesic. Then these opioid analgesics, they are co-analgesics because they act directly on the central nervous system by blocking the pain pathways, and that is how it relieves pain. Then while non-opioid, they act locally, meaning they act at the site of your peripheral body systems by blocking pain, especially during inflammation. And then that is why in non-opioid analgesic, you have non-steroidal anti-inflammatory drugs. They are a form of analgesic, but they are also part of analgesic, non-opioid analgesics that helps also to reduce or to stop inflammatory process at the same time, because wherever there is inflammation, there's always pain. So this set of drugs, they work as analgesic and they work as an anti-inflammatory drugs. They have double bond effects. So we have another one, antiemetic. Antiemetic, they are drugs used to stop vomiting. These drugs, whenever they are administered, they stop vomiting, and that is why they are called antiemetic. Emetic means vomiting. Then anti means to stop or to go against. So whenever you look at it, antiemetics are drugs that stop vomiting. An example of it is promethazine. Promethazine, one thing I want you to understand about drugs, there are drugs that always come with two bond effects, like they have primary effects and they have secondary effects, meaning there are some drugs that are designed to perform a particular task, meanwhile, whereas they have another task they perform again. So majority of antiemetic, they have primary effect, they have secondary effect. Like that of promethazine, it is an anti-allergic and it also acts as an antiemetic. Then we also have placid too. Placid is also an anti-emetic too. All these drugs, they stop vomiting. Then we have antibiotics. Antibiotics, they are drugs that kill microorganisms or stop the multiplication of microorganisms, because in antibiotics, all what they are after is just to destroy or tarnish the image of microorganisms, and we know all microorganisms are. Then in antibiotics, there are different sets of antibiotics. We have that of broad-spectrum antibiotic, we have that of narrow-spectrum antibiotic. Whenever you are talking about broad-spectrum antibiotic, they are a form of antibiotic that kill wide range of microorganisms. While when you talk about narrow-spectrum antibiotic, they are this set of antibiotics that kill limited number of microorganisms. They have boundary they get to. Whenever you administer them in narrow spectrum, they kill specific number of microorganisms or type of microorganisms, but broad spectrum antibiotics, they kill wide range of microorganisms. So these are types of antibiotics. Then we have diuretics. Diuretics, they are drugs that enhance elimination of fluid from the body, meaning they help to eliminate more fluid from the body, especially during process of urination, because kidney is one of the excretory organ where fluid is being eliminated out of the body. So this diuretic, as soon as you administer it, it enhance or it hasten the elimination of water, more water out of the body. An example of diuretic, we have different classes of diuretic too. We have that of loop diuretic, we have osmotic diuretic, we have potassium sparing diuretics, although we are going to discuss that whenever we get to that level or length. But I want you to know that diuretics are drugs that help to eliminate more fluid from the body. An example of this diuretic, we have Laxis, which is furosemide. We all know that that's very common diuretics. We all know furosemide or Laxis is very common, and as soon as you administer it, it's enhanced elimination of fluid out of the body. Then we have mannitol. Mannitol is a potassium sparing diuretic. We have a lot of diuretics. We have more diuretics and other forms of diuretics. So we have another one called antihypertensive drugs, another class called antihypertensive drugs. These are drugs that are used to lower the blood pressure. Whenever you administer it, it's always lower the blood pressure. It helps to lower the blood pressure, and that is why they are called antihypertensives. And we have different classes of antihypertensives too. We have such as angiotensin converting enzyme inhibitor, beta blocker, alpha blocker, calcium channel blockers, and angiotensin 2 receptor antagonists. We have different classes of antihypertensive. An example of one or two antihypertensive, we have propanolol, we have ismolol, we have atenolol, we have captopril, we have lisinopril, we have a numerous antibiotic, antihypertensives. So we also get there too, because at the time we're going to discuss antihypertensives as a class of drug. It's on its own. Then we also have antacids or antipeptic ulcer. I want you to say antipeptic ulcer instead of antacid, because whenever you say antacid, you are being specific. In antipeptic ulcer, these are drugs used to neutralize hydrochloric acid of the stomach. We all know that hydrochloric acid, excess production of hydrochloric acid, is one that causes or lead to peptic ulcer. So there are drugs, whenever you administer them, it neutralizes or stop or reduce the secretion of this hydrochloric acid. And these classifications of this anti-ulcer, they are made up of subclasses too. And that is where we have antacid, we have H2 receptor antagonists, then we have proton pump inhibitors and others. We have different type of, we have also protective agents. We have prostaglandin too. We have different classes of antipeptic ulcers. But whenever you say antacid, you are being specific. Antacid, they are having their subclass under anti-ulcer drugs. So we have also anti-inflammatories. Anti-inflammatories, they are drugs that are used to stop inflammation. And remember, I earlier said this whenever the very time I was explaining analgesic, I mentioned that there are some analgesics like non-steroidal anti-inflammatory drugs. These drugs, they serve the purpose of analgesic and they serve the purpose of anti-inflammatory. So these drugs, they stop inflammation. And what example of these anti-inflammatory drugs? They are like diclofenac too. Diclofenac have analgesic effect, it have anti-inflammatory effect. We have also ibuprofen. Ibuprofen has an analgesic effect, it also have anti-inflammatory effects. Then we have antiviral drugs. Antiviral drugs, they are drugs that are used in treatment of viral infections. We all have viral infections that affect the body system, like HIV, hepatitis, human papillomavirus, and we have a lot of viral infection. So these drugs particularly, they are being manufactured to treat viral infection. And what example of this drug? We have lamivudine, we have abacavir, we have zidovudine and others. We have different classes of antiviral drugs too, which I'm sure with time we are going to be picking this class one after the other. These classifications of drugs, we are going to pick them one after the other and discuss the sub-classifications of them. Then we have antifungi. Antifungi, they are drugs that are used in treatment of fungal infections. We also have fungal infections. They are infections that are caused by fungi. Fungi are one of microorganisms we have. Then an example of these fungal infections, like sometimes we do refer them as skin infections. We see the infections that affect the skin majorly, and they are called fungal infections. Then example of fungal antifungis, we have like ketoconazole, fluconazole, and we have a lot of antifungal drugs. Then, well, let's talk about the route of drug administration. Let's leave classifications of drug here. Let's talk about the route of drug administration. In the route of drug administration, here we have basically two routes of drug administration, where we have parenteral route and non-parenteral route. Whenever I talk about parenteral route, is a process in which you administer drug by piercing into the body using syringe and needle. Here you have to pierce into the body using instruments called syringe and needle. Without syringe and needle, you don't administer drug parenterally. Then what are What are example of parenteral route of drug administration? We have intravenous, that is introduction of injection or medications or drugs through the vein into the body. That is why it's called intravenous. Intra means inside, venous means inside the vein. Then we have intramuscular. Intramuscular is the process of administering drug into the body through the muscles. Here, this is where the drug passes through the muscles, then to the body. Then we have subcutaneous, that is below the skin, that is the fat layer. Skin is made up of three layers. We have epidermis, we have dermis, we have subcutaneous. So here you administer drug, we administer these drugs into the fat layer of the skin. Then we have intradermal. This is a situation where you administer drug, or this is the route where you administer drug under the epidermis. That is the second layer of the skin. Then we have intraarterial. This is a situation where you administer this drug into the body through the arteries. There are drugs, specific drugs you administer into the body through the arteries. Then we have intrathecal. This is a situation where you administer drugs into the spinal cord. Here you administer drugs like spinal anesthesias. You administer them into the body through the spinal cord. Then we have intraosseous. This is a situation where you administer drug, or this is a route in which you administer drug into the bones. We have intra-articular. This is a situation where you administer a particular drug into the body through the joints. Articular means joint, so there are drugs you administer into the body through the joints. We have intraperitoneal. There are drugs. This is a situation where you administer drug into the body through the peritoneal cavity. So we have different routes of parenteral routes in which you administer drug. Then secondly, we have non-parenteral route. In non-parenteral route here, you don't need to pierce into any part of the body. Rather, you apply these drugs either into the body through some cavity or through some body cavities or body surfaces. Example, we have oral. There are some drugs you take through the mouth, that is oral route. Then we have rectal. There are rectal or anal route. There are some drugs you put through the rectum. Then we have sublingual. Sublingual means under the tongue. There are some drugs that in which you want to administer, you have to place it under the tongue for it to be dissolved and the absorption take place and the drug start its own effect. Then we have also topical. There are drugs you administer on the surface of the skin, like the cream drugs. Then we have vaginally. There are some drugs that you administer into the body through the vagina. Then we have buccal. There are drugs that you place under the cheeks. These all are non-parenteral route of drug. Example of non-parenteral route of drug administration. Then we have inhalations. We have what? Inhalations. There are drugs that you administer into the nose. Here the patient has to inhale these drugs. That is through respiratory system. They are inhalers. These are also the nose. Our respiratory system is also route of drug administration. Then after route of drug administration, we have principles of drug administration. Principles of drug administration. These are the principles you consider during drug administration. Without this principle, you may end up administering drug either in an underdosage manner or overdosage manner. So what are these principles of drug administration? We have the right drug, the right patient, the right time, the right dosage, the right route, and right documentation. Whenever you're talking about right drug, you as a nurse, you should have known the type of drug that you administer to patient. One, you must have the knowledge of drug, and that is why you study pharmacology basically. There's no way you are going to administer drug, even if you have been given order by the physician, there's no way you are going to administer drug without knowing the drug itself. So you must have the knowledge of that drug, because the physicians are not also perfect. They might end up prescribing a wrong drug, or they may be carried away. Then is it good for you to go and continue to administer that drug? It's very, very bad. It's against medical ethics. So, and that's why you must have the knowledge. So right drug is very, very important. The right patient. You should have known the patient in which you are going to administer this drug. You don't just go to any patient and start administering drug. No, it's very wrong. You should have known the type of patient you are to administer drug. If it is patient A, you are to administer this drug to. You look at it very well, and that is why you must administer this drug to the right patient. Don't go and take drug that is used in management of hypertension and administer it to a patient that is having diabetes. It's not possible. So you must know the right patient. Then we have right time. You should have known the right time to administer such drug, because there's this simple, will I say negligence or malpractice? There's this simple negligence or malpractice. Whenever, if a drug is prescribed TDS, sometimes you give that drug before time. I don't know why you do like that. Every drug is, if the time is being given to a drug to be, for a drug to be administered, you should have wait for that time to administer that drug. I don't know if some people you want to surprise the microorganisms or what, then you administer that drug before time. It's not possible. You must wait for the time to administer that drug, because if you do not wait for that time and you administer it before that time, it will affect what we call half-life. It will affect half-life, because it will not meet up with the time taken for the concentration of drug to reach into half. Then where is the effect of drug? There's not any effect, and that is why you continue giving drug which contains such medication. At the end of the day, it will not yield positive outcome. Then let's be careful, please. Right time. Then we have right dosage. It's also our responsibility to know the dosage of drug. You don't, so sometimes we give drug under dosage because we don't know the specific dose that we will give adults or children. So we should be very, very vigilant with dosage of drug. Sometimes you may give overdosage, drug overdose. And remember, drug are, they are medicine and they are also poison. As soon as you give under overdosage, it can terminate the life of a patient instantly. And at the end of the day, you say it is the time of the patient, whereas you are the one that hasten the death of that patient. It is the time. The time is not yet, but you quicken, you fast forward to that time by giving an overdosage drug. So let's be careful. You must know the right dose of that drug. Then we have right route. We just talk about route of drug administration now. You don't give drug that you are supposed to give IV to go and administer it into IM. It's not possible. By the time you go and give drug into a wrong route, you may terminate the life of that patient immediately, because there is a route that you are supposed to administer every drug. You don't join a drug that you are supposed to give IM, you go and give it IV. It's not possible. So you must know the right route. Then we have right documentation, which is the most important part of it. In fact, any drug you know you've administered to a patient, document it too. If you fail to document it, remember drug is a poison. It may not be your fault, but after administration, one due to system or genetic makeup or whatever factors that may think may affect the effect of that drug, it may end up bringing series of reactions. And that is why whenever as a nurse, you need to monitor the patient after even administering any drug because of that documentation. There are some certain situations now the patient will be looking okay, will be good, doing whatever he wants to do. But after you notice that after you serve a certain or particular medication, the patient's condition change instantly. So this is a situation where whatever drug you administer, you document it. Without documentation, you are in trouble. You are in very deep trouble. So that is why it's very, very necessary for you to document it. So right documentation. Documentation serves as your legal backup. Then these are the principles you are to adopt during the process of drug administration. Then let's finally look at the factors that affect the effect of drugs. We have factors that affect the effect of drugs, and as well as these factors can also influence the effect of drugs. Let's look at these factors. Number one, we have gender factor. What do you mean by gender factor? Here, there are specific drugs that work more faster in male than female. There are some specific drugs that work more faster in female than male. Whenever I look at it, this is the reason. Let me explain. In male are made up of more fluid compared to female. Fluid compartment of male are much compared to that of female. So any drug you want to administer, especially if it is drug that go in line with fluid, it work more faster in male than female. Why? Is because male has more fluid than female. So there are specific in female side, there are specific drugs that are fat derivative, meaning they are source of fat, they are made up from fat. So this drug, whenever you administer it to female, is work more faster in female than male. Reason is because female have a lot of fat. They have adipose tissue. So as soon as you administer this drug, it work faster in female than male. That is what we mean by gender factor. Then we have age. In age, you need to it affects drug effect and it also influence drug effect. Most example, there are drugs that whenever you administer it to children, sorry, it work more faster in children than adults. There are some drugs that it work more faster in adults than children, and you consider dosage because there are certain doses whenever you administer to adult and you administer the same dose to a child, it may terminate the life of that child. So age is also one of the factor. Then we have genetic factor. In genetic factor, remember we are all human beings, but we are made up of different genetic makeup. My genetic makeup look different from your genetic makeup. And remember, the very time we discuss pharmacodynamic, we talk about receptor. We say receptors they are sites where drugs bind on before they act on the body system. So these receptors they are genetically made up. So if my genetic makeup is different from your own, different likewise the receptor of this particular drug that is being made up from gene of my own is going to look different from your own. So the rate in which my receptor is going to accommodate a particular drug is going to be different from the way in which your receptor is going to accommodate a particular drug. So if my receptor is bigger enough to accommodate a drug instantly, meaning the drug is going to work in my body system than yours. And that is why whenever you look at it, whenever two people at the same time take drugs, sometimes, in fact, most of the time, the drug work faster in one person than another because of genetic makeup. We have different genetic makeup, and that is how it affect and influence drug effect. Then we have also cultural factor. In cultural factor, this has to do with pure belief. Yeah, like I always tell you that drug has to do with belief. When you believe this drug is going to work for you, it's going to work. Now, let me give typical example. Try it even at home. Whenever you have PCM or you have headache, sorry, then try to buy PCM. Whenever you buy PCM, tell yourself that if I should take this PCM now, I'm sure it's not going to work for me even if I should take it. I'm very, very sure whenever you take it, it's not going to solve your problem. But whenever you take drug or you buy drug, before you take it, be rest assured, assure yourself that whenever you take it, it's going to work for you. And definitely it's going to work. And that is different between buying an expensive drug and non-expensive drug. If these drugs are, we have two drugs used in treatment of malaria now. One is sold at the rate of 300 naira and one is sold at the rate of 1000 naira. Whenever you want to buy drug of 300 naira, and you say because we have this mentality that whenever we want to buy this drug, you will see that okay, because it's 300 naira, it's not going to be effective. No, it's not possible that way. You say this one because it's 5000 naira, and this one is very expensive now, it's going to be more effective. It is not true. Drugs always work with belief. If you believe it's going to work for you, it's going to work. And if you believe it's not going to work, it's not going to work. And in cultural factor, another example is there are some cultures that don't even accept drugs at all. You no matter what you want to give them, most especially injections. There are cultures that if you want to give them blood transfusion now, they will tell you that their culture does not permit blood transfusion. Or you want to give them injection, they believe that whenever you give them injection, it's going to cause cancer to them. We have a lot of patients like that. You've seen them from even from your area of experience and practices. So these are all these are cultural factor and they affect the influence and effect of drugs because they never believe on it. So therefore, if you see somebody complain of that, you don't force it to give them. You leave them alone, you ask them of their preference treatment, then you change the treatment for them. Are we all together? Then we have immunological factor. This has to do with your body defense mechanism. We all have body soldiers. The work of our body soldiers is to protect us from fighting against foreign particles or microorganisms coming to our body. So whenever you have enough foreign body, whenever you have enough antibodies, meaning your body soldiers that protect you or that fight against microorganisms, any drug you are taking, I know the purpose of us taking drug is to terminate or to kill microorganisms. So if you have body soldiers, anytime you take in drug, these body soldiers are going to work together with this drug to fight the microorganisms. But whenever you are having low body soldiers, maybe a situation where you're supposed to have like 300 million soldiers to fight for you in your body system to fight against microorganisms, and you are having like 2 million. then do you think these soldiers are going to be enough to fight billions of microorganisms that are coming to your body? If you like continue taking drug from now till next year, the soldiers here are not going to be enough to mobilize to help this drug to fight against these microorganisms, because these microorganisms you are seeing, they are stubborn ones among them. So as soon as they come into your body, they try to destroy your body. Even if they start taking drug will not work. And that is why for people that are immunocompromised, that are having low immunity, they will continue giving them drug, and the drug will not be working. So that is just that is all about immunological factor. Then we have lastly environmental factor. Environmental factor, this has to do with environment. The nature of environment determine how this drug is going to work. There are drugs that are very effective in cold environment, whereas there are drugs that are effective in hot, warm environment. Sorry. In terms of cold environment, there is what we call vasoconstriction, meaning your blood vessels are constricted, and if your blood vessels are constricted, definitely there are not going to be free movement of blood around your body. And we know the function of blood. Blood is one that helps in transportation of these drugs. So in cold environment, here you have vasoconstriction. So if you administer drug at this moment, the drug, there is a tendency or the chance that this drug is not going to be more effective than in warm environment. In warm environment, there is vasodilation. Here your blood vessels are open, they are dilated. So there's going to be free movement of blood to every part of the body. So any drug we give at this time, and that is why in vasodilation, whenever you give drug, you see that human being, that particular person sweating. It's like the blood vessels is open and the blood are supplying, then they are supplying the blood to every part of the body. So that is environmental factor. Sorry, I forgot the last part, which is the pathological factor. In pathological factor, this has to do with disease. If you are having disease upon disease, whenever you administer drug, the effect of drug is going to reduce. If somebody is having a single or suffering from a single disease, the drug in which you are going to administer is going to work more faster in somebody having multiple disease. There are what we call syndrome. Syndrome is a collection of disease. You see somebody with 7 diseases at the same time, that is a syndrome. You don't expect to administer drug to that person to work faster in somebody having just ordinary malaria. Sorry, malaria is not ordinary. Just a condition like malaria. So here you can see the drug is going to work in someone with malaria faster than somebody with multiple disease. You see somebody with malaria, typhoid, ulcer, hypertension, diabetes. Then which drug will you give that will be more effective than somebody that is having malaria alone? So you can see pathological factor has to do with the effect and also influence of drugs. So these are the factors that affect drug effect and influence drug effect. I am sure from today's class we have learned one or two things. So therefore, I'm going to stop here for the day. Whenever we meet in our next class, we are going to continue from where we stop, or if eventually there's going to be time for us to talk about the other aspect of introduction, we'll continue from that before we go properly into the systemic pharmacology, meaning we are going to be picking these classifications of drug one after the other until we arrive at our destination. Thank you very much.
This